Yes, that's right. Nearly all eye conditions are learnt and occur after you are born. Think when you were a baby. You didn't need glasses in your crucial years to learn how to walk, see and learn. So why all of a sudden do you need glasses or contact lenses now? Dr. Sen then told me about research carried out in 1968 by Professor Francis Young. He led a research team to Alaska to study Eskimo families who were being introduced to the modern American lifestyle. This provided a unique opportunity to test the genetic theory because the parents were illiterate, whereas their children were the first generation to go through school. If the eye care and ophthalmology industry were actually telling you the truth, then the results of this study would be obvious. The parents and the children should have almost identical visual systems. The results showed quite the opposite. Only 2 out of the 130 patients had a visual condition. Yet in contrast, more than 60% of the children had developed visual conditions. These children obviously didn't inherit the visual problems, so the conclusion had to be made that their new environment, in particular school and long reading sessions, had been the cause of their eye conditions. And have you ever noticed how families seem to inherit visual conditions? It's in fact not the condition that is genetically passed on, it's the trait. For example, with parents that read a lot usually means that children will also read a lot. And in turn, these traits are passed from generation to generation. The problem with long reading sessions and the ever-increasing use of computers, mobiles and television sets is that they encourage focusing on close objects for extended periods of time. This is exactly the opposite the way nature intended and imposes a large amount of stress on the visual system. Since this research, many others have run trials and come to exactly the same conclusion. And it's not just long periods of reading and the use of computers that are causing these visual problems, but a whole array of day-to-day bad habits that we are adopting, learning and passing on. Unfortunately, these studies, just like many others, have never been made mainstream information and suppressed heavily by the eye care industry. So what does this mean for my visual problem? I asked. I was told that not only were my bad traits causing my worsening eye problems, but my glasses too. Glasses and lenses were simply neutralizing the symptoms rather than correcting or curing the problem. They were actually encouraging the current condition. Jay Lieberman writes in the Journal of the American Optometric Association that, "I have yet to hear of a research paper confirming the beneficial effects of prescribing compensatory lenses. I'm sure most optometrists will confirm the clinical observation that patients who receive compensatory lenses for full-time wear are usually the ones who need a stronger prescription every year." CJ Forkiotis from the Optometric Extension Program writes, "The emphasis on compensatory lenses has posed a problem for many years in our examinations. These lenses do not correct anything and may not serve the patient in his best interest over a period of time." Ray Gottlieb, OD, even noted in the Journal of Optometric Vision Development that the use of compensatory lenses to treat or neutralize the symptoms does not correct or cure the problem. The current education and training of eye care professionals discourages preventive and remedial treatment. In other words, the glasses and contact lenses my optometrist prescribed were not making my eyes stronger or healthier, and definitely not treating the underlying cause of the visual problem. However, Dr. Sen explained that if something is learnt, then it can be relearned, no matter your age or the extent of your visual problem. The brain is a remarkable organ, he said. Although many modern activities, such as using the computer and reading, were inevitable, it was in fact possible for me to completely reverse any eye condition back to clear 20/20 vision through a series of activities and exercises for the eyes. I would discard my counterproductive glasses for good and start to work on improving my vision, naturally and safely. He then ruffled through his desk and handed me a piece of paper with a series of handwritten eye exercises for me to perform over the period of 14 days. And then he sent me home, with no corrective lenses, no prescriptions or further appointments, just good old-fashioned wisdom. Within 14 days my myopia was gone, vanished,